What if I told you that right now in your kitchen you have a tool that can decrease your blood pressure, decrease your clot risk, decrease your cholesterol, decrease your pain, and decrease your blood sugar? What if I also told you that the same thing can cut your breast cancer risk up to 70%? Would you believe me? Well, stick around and you'll find out exactly what that is, because I'm going to share that with you today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Cardiovascular disease is the #1 killer in the United States. 1 out of 2 people die of a heart attack or a stroke. So any natural tool that we can find to help us decrease our risk is a big find. And Big Pharma has been looking for the answer to cardiovascular disease for years and have not found it, because cardiovascular disease is a chronic illness. It's a lifestyle disease. There's many inputs, from nutrition to physical activity to stress levels to toxins, that drive your cardiovascular risk. And drugs target one pathway, and it's impossible to target one pathway and decrease all those risk factors. We need a tool that targets many pathways, one tool, many pathways, instead of one drug for each pathway. So what is that pathway for us? Let's dive into that today on this video. But first, I want to discuss the many paths to cardiovascular disease. You could have hypertension or high blood pressure. You could have high cholesterol. You could have high inflammation and oxidative stress. You could have high blood sugar in the form of diabetes. Or you could have multiple of these factors, which would be called metabolic syndrome. Whichever ones are involved in your case, any tool that can help target multiple of these at once is very efficient and awesome if it's natural, because it doesn't have the side effects or adverse effects that medications may have. So the constellation of physiological issues that drive cardiovascular disease are immune activation, high LDL, which results in foam cells. The inflammation can increase blood coagulation and lead to clotting, and so we have high blood pressure, high cholesterol, inflammation, oxidative stress, and high blood sugar, which increases inflammation and promotes dyslipidemia and high cholesterol. So all of those things create a vicious cycle to increase your risk of death from cardiovascular disease. If we can find a tool to knock out each one of these, that's a major finding, and we have. That tool is called extra virgin olive oil, and that knocks out all of these guys. A major study called the PREDIMED study followed men and women aged 55 to 80 for years and had them dose extra virgin olive oil at 4 tablespoons per day. And what they found was a 31% decrease in hypertension. They found a massive reorganization of the lipid profile, significant reduction of LDL, significant increase in HDL, or the good cholesterol. They saw blood sugar markers come down, and they saw a significant reduction in inflammation. And as a bonus, they saw a 70% decrease in breast cancer risk. So extra virgin olive oil, through multiple mechanisms, decreases risk of cardiovascular disease, which is the #1 killer in the US. The #2 killer is cancer, and a large amount of those deaths are due to breast cancer. So this study, and there's many other studies on extra virgin olive oil that also show benefits for autoimmune disease. These studies show that in your kitchen right now, you likely have a tool that can do much more for you than any medication on the market in terms of cardiovascular disease risk. The study said 4 tablespoons per day, so that seems like it would be safe. One thing that you want to do if you're someone on blood thinning medication is you want to first speak with your primary care provider before implementing these strategies, so they're on board and can manage your INR properly. Anyone else, it's good to speak with the clinician you're working with as well, just to let them know the changes you're making. Another thing to know, the study was on extra virgin olive oil. when you're at the store, you may see refined olive oil. That's not the same thing. It has to say extra virgin olive oil, and if it does, then that means that olive oil was cold pressed and harvested properly to not oxidize and lose the polyphenols, which are the things that give us these benefits. Okay? If it's refined olive oil, it's been heated and processed and the polyphenols are lost, so you're not going to get these benefits. And head-to-head studies of extra virgin olive oil versus refined olive oil show that. They show that the extra virgin olive oil create the significant lipid changes, whereas the refined olive oil does not. So at the store, you want 100% extra virgin olive oil. Avoid the refined olive oil or the virgin olive oil. That's a tricky way that they label it to make you think it's what you want. So this is a big tool if you're not having enough extra virgin olive oil and the monounsaturated fats and the polyphenols that provide all of this. Start adding that to your diet. That's one piece. You also want to improve your nutrition as a whole. If you're not physically active, you need to start being physically active. You need to modulate stress, sleep, etc. If all of that is overwhelming to you, then a functional medicine practitioner is someone you should work with, because they can look at you as the individual that you are and create an individualized and specific plan for you based on exam, medical record review, and lab results so that you can achieve a life at optimal.